All right. Okay. Good morning.
Anyone's being divided. So
Oh,
sorry.
all right. Good morning, everyone. My name is Rain Lim.
I'm Puja Maran.
I'm Shahira Medina.
So, welcome to today's podcast for Business Ethics and Values Project. We are students from Taylor's University. So, today our topic for this podcast is COVID-19. As you know, COVID-19 has taken the world by storm and has changed the way we live, changed our lifestyle and how we do things. So currently the outlook on the pandemic remains dim as we speak. And the aim for this podcast is to educate our viewers and also to hopefully spread awareness regarding the symptoms and precautions of COVID-19, and also what are the effects of the pandemic towards students during this time. Let me start off by talking about the symptoms of coronavirus. So the World Health Organization has categorized coronavirus into four categories, if you will. So the common COVID-19 symptoms would be dry cough, fever, and fatigueness. So these are kind of the symptoms that we have experienced throughout our lives. So some would have taken this with a grain of salt, especially during this time. The less common symptoms would be body aches, joint pains, mild sore throat, headache, conjunctivitis, loss of taste and smell, and your discoloration. Actually, what I want to point out is the loss of taste and smell has been one of the telltale signs of the more serious cases of COVID-19. So especially if you have lost your sense of taste and smell, it is advised you go to the hospital to get tested as soon as possible, because it could possibly escalate to more serious symptoms. The severe symptoms of COVID-19 would be difficulty breathing, shortness of breath. So you realize the irregularities of your breathing patterns, and also you have loss of appetite and persistent chest pains, and you can feel like pressure on your chest. So the very rare symptoms, it does happen among individuals, but the very rare symptoms are like depression and irregular sleeping patterns. And more severe cases are like it will lead to brain inflammation. So that's when you really need to go to the hospital to you probably end up in the ICU.
So, so what happens to people who contracted COVID-19?
All right, that's a good question, Pooja. So usually what happens to people who contracted COVID-19 is majority of the cases, about 80% of the time, those who contracted COVID, they would develop the symptoms, and they would just recover without needing any hospital treatment. So they would quarantine at home, and they would just monitor their conditions, and then subsequently they'll be fine. The same cannot be said to the rest of the 20% of people. So 15% of the people, they will be seriously ill, and they really need oxygen. So they are having trouble breathing, so they need ventilators, for example. And then lastly, the 5% of the people, they are critically ill. So at this point, they are suffering from abdominal pain and also breathing difficulties. So they would be needed to be in the ICU for further assistance. So in essence, COVID-19 is a respiratory virus, right? So it starts from the lungs, it enters the lungs, it damages the lung cells, and it ends there. So it evades the lung cells, and then it will slowly die. The lung cells will slowly die, and it will cause inflammation. So once there's inflammation, that's why the most common symptom of COVID-19 is dry cough. That's why, because of the inflammation in the lungs. So dry cough and the shortness of breath and the ramping up in the phlegm production.
I heard that the one that you said 5% of the people is critically ill.
Yes.
And I heard that most of the 5% is from the elderly. Is it true?
All right. So on the onset of the COVID-19 pandemic, it is true because that's what studies have pointed out, that people of older age group, let's say starting from 60 years old and older, they are more prone to contracting the virus due to their low immune system. And then that is just for the healthy individuals who are 60 and older. So the different scenario is those who have pre-existing medical and health problems. So they have the obesity, high blood pressure, and they have heart and lung problems, and then diabetes, for example. So these are the group of people who are very much at risk from the get-go. But then the thing is, as you can see, in the grand scheme of things right now, mostly I think a lot of countries, especially India, you can see the cases going towards a upward trend. So the cases are spreading really fast. And then right now, even the younger individuals, especially people of our age, we are also susceptible in getting coronavirus. So this isn't a joke, So this doesn't mean that only the older individuals will get it. So we would also get it even though we are healthy. And especially with the new variants that are starting to pop up, the way it spreads is more contagious. It spreads really fast compared to the original strain of the Wuhan variant found in China.
So, Ryan, I'm quite curious. What are the types of COVID-19 tests out there?
Okay, so from what I know, there are two types of COVID tests available in the market right now. So the first test is the RT-PCR. So this test is the one that most hospitals are using right now because it's reliable time after time, and it gives you a very accurate result. But the downside of this is that it is very time consuming, because usually for one person the result will take 6 to 8 hours to produce, because this test it starts from taking a sample from a patient through a swab into your nose, about probably 1 inch. And basically the aim of this test is to detect the presence of viral RNA in the human's body. So this will take 6 to 8 hours, and then with the swab, you need to put it in a machine, right? So it requires a sophisticated laboratory setting. So it's not just, I take the swab and then I will get a result. So it requires a specific setting in order for it to happen. So in the event an outbreak occurs, let's say, case in point, what's happening in India right now. How do you ramp up testing when there's an outbreak in cases, right? When cases starts to spiral out of control. So at this point, the amount of samples will start to be very overwhelming for all the testing facilities. So it would, from 6 to 8 hours per person, it would require like few days or maybe weeks for people to get their results. So then they wouldn't know whether they are positive or negative, right? So how this RT-PCR works is that in the machine, they will cycle through hot and cold temperatures, and then when the machine reaches, it reaches a certain threshold, and they show fluorescent dye in the machine. That's when they can tell, like, oh, this patient is COVID positive. Whereas the other test is called the rapid antigen test. That is it's more straightforward, and it's more easily accessible everywhere without needing to go to the hospital. You can get this kit from the nearby pharmacy or something. So this kit, you get your results in 30 minutes, tops 30 minutes. So this kit is designed in a way that it can be done efficiently, like let's say on your table or by your bedside, because it's just that accessible everywhere. So you take a swab through your throat and your nostrils, and once you take the swab, you put it in a tube. I think you put it in a tube for about 15 seconds, and that fluid, you drop it, you put 2 drops of it onto the test strip. So in a way, this is quite similar to a pregnancy test, if you will. It's like when the test strip shows 2 lines, that's indicative of a person being COVID positive. But then again, this begs the question, right? Let's say if someone who have who have been in contact with COVID positive individuals, and yet their test results from the rapid antigen test says it's negative. So they could be a potential asymptomatic cases where they don't develop any symptoms, but they are COVID-19 spreaders. So it's really advisable that if you can, you should go for the RT-PCR test as compared to the rapid antigen test, because it is not that reliable compared to the RT-PCR test. Okay, so usually on average, symptoms appear in 5 to 6 days, right? So, but then as each individual varies, the development of the symptoms varies. So it is safe to say within 1 to 14 days. So in a 2-week span, your symptoms would show. If during that time that is not the case, it is very likely you are an asymptomatic patient.
What is asymptomatic cases?